The U.S. says it left the World Health Organization to protect Americans. But here's the contradiction. It walked away from the world's largest disease network without a clear replacement. So is this really about public health? Or is it about control, money, and who gets to write the rules after COVID? Because this decision reaches far beyond the WHO, and it could change how the world handles the next global crisis. Here's what we know. The United States has officially withdrawn from the World Health Organization, the UN's main global health agency. This follows an executive order signed by President Donald Trump roughly a year earlier, at the start of his second term. The U.S. government says the withdrawal is final. The Department of Health and Human Services gave three main reasons. First, it says the WHO mishandled the COVID-19 pandemic. Second, that the organization failed to reform. And third, that it became politically influenced by member states, especially China. President Trump has repeatedly accused the WHO of being too China-centric during COVID. The WHO rejects those claims. Its Director General, Tedros Adhanom Ghebreyesus, called the U.S. exit a loss for both America and global health. The organization points to its work fighting polio and HIV, reducing maternal mortality, and enforcing a global tobacco control treaty. Financially, the U.S. has long been one of the WHO's biggest donors. Washington did not pay its assessed contributions for 2024 or 2025. That shortfall has already led to major job losses inside the organization. WHO lawyers say the U.S. still owes about $260 million in unpaid fees. The U.S. government says it does not recognize any obligation to pay. Operationally, the brake is sweeping. All U.S. government funding to the WHO has been cut. U.S. personnel and contractors have been recalled from Geneva and other offices. And hundreds of U.S. WHO engagements have been suspended or ended. U.S. Health Secretary Robert F. Kennedy and Secretary of State Marco Rubio said the WHO had abandoned its core mission and acted against U.S. interests. They said future U.S. engagement would be limited to managing the withdrawal and protecting American health. The U.S. says it will pursue bilateral disease surveillance and pathogen-sharing agreements, but it has not named any specific partner countries. For programs like polio, HIV, and vaccine development, officials say the U.S. will work with NGOs and faith-based groups. No details were provided. Officials were also unsure whether the U.S. would continue participating in global influenza vaccine data sharing. Now let's separate facts from analysis. The official explanation frames this as a technical failure. Bad pandemic management. Too much politics. Not enough reform. But that explanation assumes something important. It assumes the WHO's core problem is incompetence, not governance. That assumption is rarely challenged in mainstream coverage. Here's why that matters. The WHO doesn't just run health programs. It sets norms, standards, and emergency rules. Rules that affect borders, travel, supply chains, and intellectual property. After COVID, member states negotiated a global pandemic treaty. The goal was to coordinate lockdowns, data sharing, and vaccine distribution in future crises. Every WHO member agreed to it, except one, the United States. From Washington's perspective, this treaty would have limited U.S. freedom of action during the next emergency, especially when it comes to vaccine control, export restrictions, and emergency declarations. Leaving the WHO removes the U.S. from a system where it could be bound by rules it no longer fully controls. That's power dynamic number one. The second one is China. Yes, China's influence inside the WHO has grown. That part is real and widely acknowledged. But China is not the WHO's largest funder. the US was. That creates a deeper tension. America was paying the most, but no longer getting its way. From this angle, the issue isn't simply Chinese control, it's diluted American leverage. There are two main ways to interpret this. The first is ideological. The US exit fits a broader pattern. Skepticism toward multilateral institutions, a preference for bilateral deals, and resistance to binding international frameworks. From this view, leaving the WHO isn't really about health performance. It's about avoiding external constraints on US policy. The second interpretation is domestic. COVID remains politically toxic inside the US. Leaving the WHO shifts blame outward. Pandemic failures can be tied to a corrupt global body instead of domestic decision-making. This interpretation doesn't require the WHO to be effective, only politically useful. One important caveat. None of these interpretations can be proven definitively with current statements, but they do explain what the official narrative doesn't, especially the absence of a clear replacement system. In the short term, the effects are already visible. The WHO loses funding, staff, and operational capacity, especially in disease surveillance and emergency coordination. The US loses immediate access to key systems, early warning networks, on-the-ground outbreak reporting, and centralized coordination for vaccine strain selection. In the short run, that might be manageable. In the long run, it's riskier. Institutionally, the WHO becomes weaker, but it isn't replaced. That leads to fragmentation, not reform. Geopolitically, influence shifts. China, the EU, and middle-income countries gain more sway inside the WHO, not because they suddenly dominate, but because the US is no longer there. From an economic and health perspective, the risk is simple. Pandemics don't respect borders. When surveillance and response systems fragment, outbreaks are harder to stop early. And early intervention is always the cheapest option. So who benefits? Governments that prefer looser global coordination, countries expanding influence inside UN institutions, and private actors operating outside WHO frameworks. Who loses? Smaller countries that rely on centralized health support, global disease monitoring systems, and potentially the US if it later needs cooperation without formal leverage. Most importantly, this decision pushes the world toward ad hoc crisis management, slower, more political, and less predictable. Several questions remain unanswered. First, what replaces the WHO for the United States? So far, no alternative architecture has been announced. Second, which countries has the US secured bilateral disease-sharing agreements with? Officials haven't said. Third, in the next global health emergency, does the US quietly re-enter coordination efforts, or does it stay out on principle? Fourth, what happens to vaccine development cycles, especially for influenza, where global data sharing is critical? And finally, does a future administration reverse this decision, or does the US permanently step back from global health governance? That's the question to watch. Because once global systems break apart, rebuilding them is much harder than walking away.